Think Tank is pleased to welcome Michellene Davis, who is Executive Vice President, Chief Corporate Affairs Officer, RWJBarnabas Health, and underwriter of our programming. And also, Michellene is a trustee of the CAUCUS Educational Corporation, our production company. How you doing?
I am well. How are you?
I'm doing great. Let's talk about, we have these conversations about, quote, social determinants of health, defined as?
Social determinants of health really are the experiences that you have outside of a clinical setting. So how people live, work, age, and really spend their lives.
You know, it's interesting. One of the areas with your social impact and community investment team, where I've done some leadership coaching with them, they focus on a variety of these social determinants. One of them is housing. Make this clear. The connection between affordable, quality housing and healthcare, A, and then B, we'll talk about exactly what's going on there.
Sure. Well, I will tell you, Steve, the evidence and research has really borne out the fact that housing is such a huge determinant about the outcomes of health of individuals.
How so?
Oh, my goodness. So research has evidenced the fact that housing has literally been shown to ensure that individuals, quite frankly, have better mental health days, right? Have better access to other supports within systems. We literally pursue it as a housing first model because once we get you into housing, then we can really surround individuals with all of the requisite other needs that they actually have. But everything from asthma to hypertension, stress and anxiety, all impacted by whether or not you have safe, secure, affordable housing.
Michellene, let's pick up on exactly what the Health Network is doing, particularly in the city of Newark and in other communities, but starting with Newark.
So in Newark, New Jersey, we are proud. We recently announced a partnership with the state through the Department of Community Affairs HMFA program.
New Jersey Housing Mortgage Financing
Authority.
It's not like we don't have enough acronyms.
All true, all true.
Okay.
And
to do what, though?
Oh, my goodness, to literally enter into the nation's first model of its kind. So why do I say that? I say that because for the first time, we are seeing, not just in the state of New Jersey, but quite frankly across the country, the fact that the state, through one of its state agencies, are literally putting in a significant percentage as an incentive to get more hospitals to really invest in housing because housing has such an incredible impact on health and health outcomes.
How many units?
So we are looking at between 60 and 70 units. We are at the very early stages. We have other partners. Penrose, the city of Newark, has been a tremendous partner in that. The Hospital Association has also partnered with the state in order to make certain that evidence is out there to encourage more hospitals to do so. But these partners are coming together in order to do this in a way which, as you know, is really the RWJBarnabas way, in that we will ensure that it also includes our other social impact and anchor mission of utilizing local professional services, utilizing local employees in order to really build this entire unit up. The individuals who will be a part of this new growing community will be those individuals who, most individuals call them frequent flyers. I like to call them familiar faces. Which
Moving
is
in and out of the emergency
room.
department. Yeah.
Absolutely.
Which is a huge problem.
It is, in fact. It's our most expensive door, right? The most expensive door of a hospital is the emergency door. And so as a result of that, it really seeks to make certain that these individuals have more than just a medical home, have a home, in fact. But then, in addition, we are also looking to make certain that those individuals who we are locally hiring do not get up and then move out of the city as a result of growing up through livable wage, but quite frankly, find within their own beloved city in the South Ward of Newark, which is a rich history there, really the kind of living environment that they both deserve and that they need.
You know, it's interesting, social determinants of health, and I moderate a quarterly forum, the Newark Community Advisory Board forum that is held at one of your hospitals at Newark Beth. And the folks there are from lots of different not-for-profits or organizations, religious organizations, community-based organizations. And what strikes me, I don't want to say it takes a village because someone else said it first. Does it take at least a village to deal with social determinants of health? Housing, employment, transportation, a whole range of issues. Does it take way more than one healthcare system?
Absolutely. Steve, no one entity can do this alone. And if, in fact, they think that they can, I'm concerned. You mentioned the Greater Newark Community Advisory Board. So first of all, two things. One, it takes a village is actually an old African proverb. So no one said it first before we did. So you can say it as much as you want.
Mrs. Secretary Clinton heard
she
it
was
before.
quoting us. And as a result of that...
I knew you would correct me. Go ahead.
In addition, but always in love. But in addition to that is the fact that these individuals who make up the GNCAB, the Greater Newark Community Advisory Board, represent everything from clergy to law enforcement, the city council to legislators at the state level, just across the board.
Sorry for interrupting. Someone says, what the heck does that have to do with healthcare, you say?
Oh, everything. And it is because of the fact that everything that we do is not something that gets baked inside of an ivory tower. Rather, it is that which literally we take a look at the data, right, that comes through our emergency room door and other ports of entry in the healthcare system and at that particular hospital. But more than that, we also want to make certain that this is an opportunity for collective impact and community co-design. Listen, we do not jump in front of our community. They know their felt needs better than any data that we could ever collect. And so, quite frankly, what our role is, right, our new mission...
As a very large healthcare system.
As a very large healthcare system is to make certain that they are in the design seat of meeting their own community needs, right? That we literally are entering into a dialogue with them that is true and real and authentic. And so, when we begin to talk about what are the socioeconomic issues that are impacting you on a daily basis, lots of folks call them the social determinants of health.
Right.
I like the term political determinants of health. That has a lot to do. We'll have another story about that one day. But really about the systems and structures that help to create the inequities that we see that show up as poor health outcomes in certain areas, right?
Including institutional racism.
Absolutely,
as a piece of a much larger equation.
Absolutely.
Go ahead.
Right? And so I say all the time, listen, anchor work can really be wonderful.
You keep saying anchor work. Explain to folks what the anchor means.
Absolutely. So most eds and meds actually are anchor institutions, but it is
educational institutions and pharmaceutical institutions, healthcare organizations. Go ahead.
Absolutely. But really, it takes an intentional commitment. As an anchor, it means that I'm going to utilize our place-based presence, right? The fact that hospitals are not in communities for 5-10 minutes most often, right? Truth be told, the one that's in the South Ward of Newark, just because we're talking about that right now, has been there for almost 120 years, right? The one facility that we have up in Livingston has been there for 152 years. These entities are there for the long term. So they have the ability to anchor the communities in which they sit. Right? So if, in fact, we were to utilize our place-based presence in order to shore up not just ourselves, but quite frankly, the economies of the communities outside our doors, what would that community begin to look like?
And by the way, let's clarify, RWJBarnabas Health, and again, an underwriter of what we are doing, is in a lot of communities. How many hospitals?
Oh, my goodness. So we have 11, unless you count the children's hospitals inside of our hospitals, and then we're at 15. But that also depends on the day of week that we're talking about, because I have to tell you, there's so much M&A activity happening across the state.
Are you implying that healthcare is changing every day? So Michellene Davis also, by the way, is going to join us on a very comprehensive think tank panel in which we'll be looking at healthcare issues from a variety of perspectives. What's going on Washington, in Trenton, and who's involved. Michellene, thank you for joining us on Think Tank.
Thank you.
Well done. I'm Steve Adubato. We'll be right back.
Think Tank with Steve Adubato has been a production of the CAUCUS Educational Corporation. Funding has been provided by MD Advantage Insurance Company, NJM Insurance Group, Horizon Blue Cross Blue Shield of New Jersey, New Jersey Sharing Network, the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, Gibbons PC, Wells Fargo, and by Fedway Associates, Inc. Promotional support provided by Meadowlands Chamber and by NJ Biz. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.